Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started. All right, guys, welcome back to another episode of Nurses Uncorked, a space for truth, connection, and the courage to challenge the status quo. I'm Nurse Erica. I'm here to inform, empower, and advocate for every nurse and healthcare professional out there. I want to thank everyone for downloading this episode. If you haven't already, please leave a review, rate, and share with friends. It goes a long way in helping out. Just a reminder that patrons of the podcast get early access to episodes, patron-only bonus episodes, and Zoom parties for as little as $5 a month. There is a link in the episode description. All right, so this episode this week is going to be a little bit of a different one. That's because I just had surgery. And even though it was a planned surgery and I had all these great intentions of having all these episodes ready to go, this surgery has thrown me for a loop and the recovery has been less than easy and still have a long way to go. But I have been getting inundated with questions from people wanting to know about my surgery and recovery, which I really didn't expect because that's not my content, at all. So I had posted a few things along the way on social media, but I really didn't expect there to be a lot of interest. I expected either supporters or haters in the comments, but not necessarily a lot of interest, And so I think it's too much to put in one 10-minute social media post. It's too much. So I thought I would do an episode about it, and then people can come and listen to this, the ones that are interested. My nursing view of life and everything in general, of course, has shaped this process for me and my recovery, because of course I look at everything through a nurse's lens. But other than that, it's this isn't necessarily nurse advocacy, but I hope you will stick around for the episode nonetheless. There are a couple exciting episodes coming up in the near future, a couple of exciting guests I have lined up, and so I will be bringing you more about that soon. But let's start at the beginning. I don't know. I don't have any notes or anything, so this might be a little bit all over the place, but this is kind of what led me to this point. So, I've been on a GLP-1 journey for a while now. Still am. Lost a considerable amount of weight. And even before I had lost that weight, I needed to have these surgeries done. So that's been a big question I've gotten a lot. I wish I would have done this many, like 15 years ago or something, but better late than never, right? So on October 10th, I had 2 procedures at the same time, which we'll get into that. I don't know if that was a good decision or not. I had an abdominoplasty, which is basically a tummy tuck with a whole bunch of liposuction, and it's like hip to hip. And then I had bilateral brachioplasty, which is an arm lift, both sides, of course. So my whole thing was, if I can do 2 procedures at once and it stay under whatever the threshold is, I'm not even sure, for, not exceeding the amount of time you're under anesthesia where your risk increases, then that's what I wanted to do. And I met with several surgeons before making a decision, and they all said, yeah, you can do those 2 procedures together. That was not an issue on their end. They said you couldn't do more than that. Like, you can't add on a third, but those 2 are doable in that time frame. So it ends up being like a 7-ish hour surgery, which I don't think I really realized until my pre-op appointment, how long that is. And that's very daunting. Like, that made it scary and real for me, So I went off the GLP-1s as you're supposed to do prior to anesthesia. I believe they recommend like 10 days, 2 weeks. I went off for like 3 weeks just to be safe, maybe even a little over 3 weeks because I didn't want to take any chances. I'm always erring on the side of caution. I didn't resume it until a week ago, honestly. So I have been off GLP-1s for 5-ish weeks, which is a big chunk of time. So I did not, just for those that are curious about that component, I did not resume at the same dosage that I was because it's been such a gap. I just kind of dosed myself in true nurse fashion and I did about half the dose that I had been at for my first dose. And so, we'll see how it goes from there. But yes, if you are on GLP-1s and you have a procedure with anesthesia, because delayed gastric emptying can lead to a lot of problems with anesthesia. And you always need to make sure that your anesthesiologist is aware that you're on a GLP-1 and when was your last dose and all that stuff. That's important. Okay. So as I said, I met with a few different plastic surgeons, met with one cosmetic surgeon. So for those that don't know, you want to go with a plastic surgeon, a board certified plastic surgeon. And I didn't have a great understanding of this. I mean, I kind of knew, but I never really had to think about it before. But cosmetic surgeons are like the lower echelon, but what you want is a board certified plastic surgeon. So you don't want a dermatologist that's going to do your tummy tuck, something. You want a board certified plastic surgeon. So I did actually meet with one cosmetic surgeon who was double board certified in surgery, but not in plastic surgery. Liked them a lot. Probably would have gone with them had it not been for the fact that they weren't a plastic surgeon, Met with another one here in Las Vegas whom I really, really liked him a whole lot too. He was a bit more expensive, and I'll get into the cost of things for those that want to know. I had full confidence in him. He spent a great deal of time explaining everything to me at the consultation. And I don't know if it was a free consultation. It might have been like a $100 fee or something I don't remember, but it wasn't a great deal of money. And he spent quite a bit of time with me. And the only reason I didn't go with him was because he wanted to do a Fleur De Lis incision for the tummy tuck, which is where you have both the vertical and horizontal bikini line incision. So you have the full vertical, like from your sternum down, and then you have the full horizontal incision, like hip to hip, bikini line. And that scared the crap out of me because I thought that's like being filleted like a fish. You are so open, so prone to so many complications. In my mind, I just kept thinking wound dehiscence, which ironically I ended up having anyway, but not on my abdomen. And we'll get into that. So that's the reason I didn't go with him. Otherwise, I think he probably would have done a phenomenal job and I had full confidence in him. And these are just like my own decision making thoughts, as I went through it. And then I met with a couple more here in Las Vegas. And, I didn't mention to them anything about the Fleur De Lis incision that the other surgeon had mentioned. I wanted to see if they recommended the same thing, and they didn't. And then I finally did ask the surgeon that I ended up going with, which is, for those that are curious that happen to live in Las Vegas, it's Dr. Jeffrey Roth. I believe the business name is Las Vegas Plastic Surgery. I asked him about it, and he said, well, there's nothing wrong with that approach. It's kind of like a surgeon's preference, and there's different ways to skin a cat, and that's one way of doing it. I don't personally do that very often. I don't think that you need it, but there's nothing wrong with that. And I thought that was a great answer. And so I ended up going, like I said, with Dr. Jeffrey Roth. He was very nice when I met with him for the consultation. He's been in town a long time. I believe he's head of plastics at Southern Hills, I want to say, hospital, and thoroughly researched him, of course, me being me, and did not find anything alarming of concern, nothing. And I did a deep dive. So I did do my homework, and I really thought I was prepared for surgery. I was not. And that's kind of embarrassing to say because I am a nurse, right? You would think I would be prepared. And by not being prepared, it sounds silly for me to say, but I don't think I was prepared for how difficult the recovery is or was going to be. And of course, I knew it was going to be difficult, of course. But oh my gosh, is it so much more difficult and challenging? And the emotions behind it, like no one talks about that, which is fascinating to me because it has been an emotional roller coaster for me the last 3 weeks. And there's, other stuff, big life changes that happened in my life immediately preceding surgery, which probably was not great timing, but that's life. That probably played in with that. But no one talks about the emotional component of recovering from anything. So October 10th, went in for my, let's see, I did have some questions about how I prepared preoperatively. Let me see. I didn't have to do any crazy HIPAA bath or anything. They didn't have me do anything like that. I just was obviously very careful about being extremely clean before going in. I washed my hair, braided my hair, French braid tight because you don't know when's the next time you're going to get to wash your hair. I wanted it out of the way. Clean your belly button, y'all, before you go into surgery. You'd be surprised how many people don't clean their belly buttons out. And that's gross. Make sure you clean everything. You trim everything. They didn't have me shave. Had a lot of questions about that. But then when I was in pre-op, the nurses were like, oh, we might have to shave you, there. Like, why didn't anybody tell? I would have totally gone and gotten waxed. Why did they not tell me that? But it was very minimal and very short, so they did not end up having to shave me, TMI. But other than that, for pre-op, I changed my sheets, made sure everything in my room where I was going to be immediately after was very clean. I cleaned my whole bathroom, bedroom, top to bottom. I just didn't want any, chance of infection anywhere. I set everything up with a wedge pillow. They told me you need to sleep elevated. They say if you have a recliner, that's the best case scenario. I don't have a recliner. Some people actually rent them for these surgeries. So I had a wedge pillow from something from before. And so I set it all up with a bunch of other pillows and all the things. You also need a big pillow under your knees. They want you to be at like a V position, sleeping for quite a while afterwards. So anyway, so I had my room clean, all of that set up. Anything that I thought I might need, I made sure it was within reach in my room prior to surgery. And so the day of surgery, I had to be there at 6 a.m. My daughter drove me. I was obviously NPO since like 10 the night before, I think. And I was thirsty. That's hard. I don't care about not eating, but it's hard to not drink. That was rough. Very nervous in the morning. Very, very, very nervous. They took me back immediately. They put in an IV. And okay, you want to hear the most embarrassing blonde moment for a nurse? She put in the IV in my hand, and I'm watching her put it in. She didn't do anything wrong, but I say, that's weird. I would have assumed they would want it at least in the AC. Because, closer to the heart. And she looks at me and she goes, well, they're going to be working on your AC. I'm like, you right. That was embarrassing, obviously. Duh. Very blonde moment of me. Nonetheless, the IV was positional. And I remember being super nervous about it and telling the anesthesiologist when they wheeled me into the OR, like, it's positional because I had this fear that it's going to displace and then I'm not going to be getting anesthesia, It did not. That did not happen. But I do think she hit a nerve, which is beyond control, right? Not her fault. But I do think she hit a nerve because that whole half of my hand was numb for days and days after surgery. Significant bruising too, but that's okay. We know that happens, right? So pre-op, the doctor came in, met with him. He did a million more pictures and marked me up with the Sharpie, surgical Sharpie all over the place. Anesthesiologist comes in and I had seen him through the curtain and I'm like, I know him. I totally know him. And he comes in, he introduces himself and I said, hey, I'm not going to say his name, but I said, hey, first name. We definitely graduated high school together. And he's like, we did? And I said, yeah, class of fill in the blank. We were the fill in the blank. And he's like, oh my God, yes. So that was funny. And that kind of made me feel a little bit better because I don't know, any kind of connection, you feel like maybe they're going to take better care of you. I don't know. We didn't really know each other in high school. He was the football team quarterback. Like, he was that guy. I was a big nerd in high school. So pre-op was fine, other than me being nervous. Then they wheel me in. I remember being wheeled in. It was probably like 7:30 maybe a.m. I remember telling the anesthesiologist about my IV being positional. I remember moving from the stretcher to the table, and that's it. That's all I remember. I don't remember them having me count backwards or anything like that. That's all I remember. And then I remember waking up as they are wheeling me out of the OR into the PACU area, into my curtained little area. And my immediate thought, as soon as I woke up, was, oh my God, I am in a lot of pain. And that concerned me a lot because maybe naively, I thought, shouldn't you still be under the effects of a good chunk of anesthesia at that point to where you're not in it really horrific pain? Like, not that you're going to be pain free, don't get me wrong. But I was concerned at how much pain I was in. Like, it was a solid 8 out of 10. And so I kept saying, I'm in significant pain. That's all I could say. I don't want to be a baby. I don't want to be a complainer, but I just kept saying, I'm in significant pain. And finally someone said, what would you rate your pain? And I said, 8. So they eventually got me Dilaudid, didn't touch me, like, at all. They gave me a second dose of Dilaudid. I don't know how long later. Didn't touch me at all. Like, not at all. By, I think, the third dose, maybe the fourth, I think the third, it finally started to help alleviate some of the pain. But what then ended up happening is I could not stay awake, which understandably, because I was snowed and I do not have much experience taking a lot of narcotics, pain medication at all. Like when I had my kids, that's about it, right? I've never really had to take anything. I could not stay awake to the point where they got me up to walk for the first time, to stand, and I could have so easily fallen asleep standing and fallen to the ground. Like, it was bad, how uncontrollable it was for me to stay awake. And so I started saying that I'm concerned that I'm not able to stay awake. Like, am I going to fall asleep in the car on the way home and not wake up again? Because it seemed like it was that severe. And I realized that's an overreaction. But in my mind, that's really what I was thinking. And so I don't know if I asked for it or one of them suggested it, one of the nurses, but they did an ACU check just to make sure I wasn't low. And it was like 155. It was not low. And I was glad that they checked that. My blood pressure was okay. They had me, I think, drink some juice and eat a couple crackers like they do. And it was just this whole I can't stay awake conversation. Okay, so in my mind, this whole thing in PACU played out over maybe 2 hours max from when they wheeled me out to when I left, in my mind. Well, come to find out, it was a whole lot more than 2 hours. It was, because I don't know exactly when surgery ended. It might have been 5 or 6 hours. And that's embarrassing because who the hell stays in PACU for 5 or 6 hours? Like, that's insane, right? All I can say is my nurse was very patient with me, very patient. I had a lot of people asking if they knew who I was, quote unquote. I don't know. I have no idea. No one said anything to me. So they maybe did and didn't say anything, which honestly I prefer because I think it's mortifying if they do know. But nonetheless, she was very patient with me. And I didn't catch her name, or I don't remember it. But when the surgical center, because this was done at an outpatient surgery center, when they called to do their check on me 3 days post-op, I think, I did ask them to please relay a message to her and that I didn't know her name and to thank her profusely. And I brought them donuts before the surgery, like really, really good donuts. I brought a couple of huge boxes because I wanted them to be nice to me. So I do remember her saying to me in PACU, like, no, I just want you to be comfortable going home, as long as it takes. I just want you to be comfortable. And then I also remember one of the other, I don't know if it was a nurse or not, coming in a couple of times into my little curtain area in PACU saying, well, who's going to close tonight? Like, who's closing the clinic? So that means it was late. Did they all stay open late and have to work overtime because of me? Because That makes me feel terrible. And that is not what I want. And that's mortifying. But in my mind, it was only like maybe 2 hours at the most, which goes to show you just how well my mind was not working. Eventually they bring my daughter back. They had called her and said, okay, she's in PACU. You can come back down, because like a normal person, I probably would have been discharged within not too much longer. But she sat there and watched a whole movie. She watched Beetlejuice in the lobby before they ever brought her back. She said she hadn't eaten that day. It'd been a lot of crazy stuff going on. Didn't have her water with her. And then when they brought her back, it was when they had me standing up trying to walk. And she said I looked so white, which is a lot for me because I am white. But she said I looked so white, and that she could tell how much pain I was in, that she thought she was going to faint. And she had to sit down on my bed and ask for water. Poor thing. So she was back there with me in PACU for quite a while. Finally, they make the decision. I can finally go home. I don't know how they finally got past me saying I can't stay awake, but somehow or another we finally did. Then there was some sort of conversation about what am I going to wear out, which, I had brought clothes that would have been appropriate to put on that were like baggy, but I didn't care. I didn't want to move unnecessarily to try to put them on. So I just said, can I go home like this in the gown? And the first nurse said, yeah, no problem. And then the other nurse was arguing, I don't know if she was a nurse, was arguing with the first one as they're wheeling me down the hall saying, are you sure she can take the gown? You better check with, I don't know, manager, whatever, because they're not allowed to take those. And those are pretty expensive. And I just remember thinking, why are we talking about this in front of the patient? Like, why? That's so inappropriate. But also, whatever. I do think it was a brand new gown. They gave it to me in a bag when I had first gotten there. And it's actually a very nice gown. And I'm going to keep it for a Halloween costume one day. But yeah, so now that's a joke between my daughter and I, is my very expensive hospital gown that they didn't want me to keep. Well, one of them didn't want me to keep. Silly. But nonetheless, got in the car. It was pitch black outside. Did not fall asleep driving home, which was my fear that I wouldn't wake up. Got home. Purposely had my daughter take her car because it's a much higher sitting car. My car would have been a nightmare. It's very low to the ground to try and get in and out of. So I'm glad we thought ahead for that. Getting from the car into my room was nothing short of a miracle. And it took forever. It probably took 30 minutes. I don't know. And it's not like I have a big house, okay? It was not a long distance, and only had to go up one step from the garage into the house. And that was like climbing a mountain. And I was so nervous because of 2 dogs in the house, and I didn't want them to jump at me. I came home with a Foley. I came home with 2 JP drains. And so she went in and put them all behind a gate so they couldn't get at me. But as soon as I walked in, the dogs knew there was something not right. They know, they can sense it. And so my dog especially was whining, crying, barking, what's wrong with her? But we got me to bed, and getting in and out of bed first 3 days is hell on earth. I'm not gonna try and sugarcoat anything. Hell on earth. That is the hardest thing in the world to get in and out of bed those first 3-4 days. It isn't nothing short of a miracle and a team effort to accomplish that. It's absolutely the hardest thing ever. And it takes forever, because you are sure that every single tiny movement is going to result in you just splitting open. That's how it feels. So now I have, because I'm only 3 weeks post-op plus 1 day, 3 large incisions, okay? 1 bikini line incision, hip to hip, hip. It's not just in front, it's hip to hip, okay? In the front, it doesn't go all the way around in the back, but you know what I'm saying. And that's where I had the 2 JPs, one on the right, one on the left. I still have 1 JP drain, so help me God, if it doesn't come out this week, I'm going to lose my mind. And 2 arm incisions, and these are huge incisions. They go from your armpit, a little below your armpit, to almost to your elbow on the bottom inside of your arm. It's long. So I have 3 major incisions. It's a lot. Abdominal surgery is the hardest thing to recover from in general, right? As far as movement and limitations after surgery. So most people, when they have any kind of abdominal surgery, will overcompensate by using their arms to change positions and stuff. Well, I couldn't do that because my arms, right? So you can imagine very, very challenging, right? So finally get in bed, get settled with my lovely wedge pillow. And that's hard because I'm a side sleeper. I never sleep on my back, let alone elevated like that. But I also am a big rule follower. Like doctor tells me to do something, I'm going to do it, you know? So I did what they said and I'm still sleeping like that to this day. He did say last week that I could try sleeping on my side and I just can't get comfortable yet. I'm just not there. I did get rid of the wedge pillow. I'm not using as many pillows, but I'm still on my back, still with a pillow under my knees, and still with a pillow under each arm elevated. Like it's a whole setup. You should see me. And it takes a while, even now, to get situated. But got in bed, took took my meds. He prescribed me ahead of time. I filled the scripts ahead of time. Norco and oh God, what's the name of it? Muscle relaxer. He also gave me Zofran. I never ended up needing the Zofran or taking any of that. But I took meds when I got home, like they told me. And I think I just went to sleep. And my daughter was setting alarms to wake me up to give me medication throughout the night. One, when I had an antibiotic, I had cephalexin as well. So I think the cephalexin and the muscle relaxer were on the same schedule. And then 2 hours alternating was the Norco. So I was waking up every couple of hours to take something. And she was in charge of all that. And she had to have a crash course in emptying the Foley and the 2 JP drains. For those that don't know, a JP drain, it just kind of looks like a grenade. It's about the size of a grenade, but it's just this like silicone plastic collapsible little thing that you squeeze. You squeeze all the air out of it, then you plug it, and the natural suction that is created is what naturally pulls any fluid buildup out. And so then every time you empty it, you have to recompress it and plug it again. I think I made her paranoid about the Foley because in my high on medications self, I was like, how much is the output? How much? I think I was a little bit paranoid about the Foley output. And I kept saying, how much urine output? How much? And she doesn't know. She doesn't care. She doesn't understand that stuff. And then I kept telling her how important it is that you watch the tubing, that it not get kinked, that it not be above me. Because I think she held the bag up a couple of times. I'm like, no, you can't do that. Don't let it drain back into me. So I had her a little paranoid about the Foley. But by the end, boy, she was really an expert in all these things. And God love her because my daughter has a degree in kinesiology. So she has a good understanding of body mechanics, but she's also very strong. Like she's young and tiny and is abnormally strong for her size. You would not think. Like she has huge arm muscles. Anyway, that's exactly what I needed because changing positions, like I said, was hell on earth. Anything that I said to her, like, pull me this way, do this, pull here, she did it. There was no problem. She was Johnny on the spot doing all of it. She would jump on the bed, get behind me, do whatever weird maneuver to shift me 3 inches to the left or whatever. I finally said, we need a draw sheet. She didn't know what a draw sheet was. So I told her a draw sheet. We put a draw sheet on the bed to help me be able to shift, you know? Yeah, she had a crash course in nursing. This girl did, but she was a godsend those first few days. She truly was. And setting the alarm all night, getting up, giving me stuff, checking my drains, emptying things. The first day, got up. I think I brushed my teeth. That might have even been the second day. I don't know. It's a little bit of a blur. Brush my teeth. I mean, it took like 15 minutes just to get out of bed and then another 10 minutes to walk from the bed to the sink. And it's close. Like it's in my room. Brush my teeth. And then the intention was to go out to the living room. I couldn't do it. I could not do it. That was the amount of walking I did the first day, was just getting up in my room, taking a few steps in my room. I never left my room the first day. Going into the bathroom, that's it. That is all I could handle the first day. And that's not great because like you should be getting up, right? Obviously you want to minimize any risk of clots or anything. I did have on TED hose and you should be walking considerably more. I could not physically do it. It was so painful. I could not do it. So I was just walking in my room the first day. Second day, I believe I made it out to the couch. It might have been the third day. It might have even been the third day before I made it out to the couch. And that was a big accomplishment. And then I sat on my couch in my favorite spot and couldn't get comfortable in my favorite spot, no matter what. And everything was very precarious because the dogs had to be kept away from me because, one dog jumping on you wrong, right? On your incision or catching one of your drains or Foley, that's terrible, right? So we had all these barriers keeping dogs away. Like the house was looking crazy. Finally had to make a new home on the couch. They have a big sectional, so it was on the opposite end where I finally was a little bit more supported and comfortable. I really do wish I'd had a recliner. That's one thing I might consider doing differently in retrospect, is actually renting one of those, which you can do for surgery, because that would have been helpful, but you don't need it for that long. I actually did buy a raised toilet seat because the thought of getting up and down that low, mine are pretty low, scared the crap out of me. So I got that. My daughter installed it for me. I only ended up using that for like 3 days. Honestly, that probably wasn't worth it. I probably would not get that again. I could have made do without the elevated toilet seat. What other stuff did I get? I did, on the advice of the surgeon's assistant, order one of those belts that hold the JP drains. Comes with 4 different pockets for people that have a bunch of JPs. So I took off 2 of them. I did get an extra compression garment. They send you home in one, but need an extra so you can wash them, What else? They told me to get, what is it called? Arnica? Am I saying that right? Arnica? I wasn't totally familiar with that. It's a over-the-counter homeopathic thing. It helps with bruising, edema, bleeding. There's a topical gel and these little oral tablet things. I don't know that it does anything. I don't know. People swear by it. I've been using it. I don't know that it's doing anything, but maybe it is, and I don't realize. What else? I also ordered a separate 2 other garments, one that was a different style and one that was just for the arms, just in case. And I think that's everything I got ahead of time. So yeah, I would get a recliner if I had it to redo, but I wouldn't get the elevated toilet seat. I did not get a walker. A lot of people end up getting a walker. I didn't do that. I just did the whole furniture surfing thing, like people do, and holding on to my daughter those first few days. Okay, so ate a little bit day 1, the day after surgery, not a lot. Really didn't have an appetite, really had to push myself to eat. I was afraid I was going to get sick taking all the antibiotics and then the pain meds without it. But I was drinking protein shakes from day 1. Probably was not getting enough liquids though, because it's a lot of sleeping, So you're just not awake enough to drink as much liquids as you normally would in a day. My appetite was not much for probably a week and a half. There were a couple of days in there where I did have more of an appetite, but in general, I just really didn't have an appetite for about a week and a half. Supplements. I am big on supplements anyway. So supplements that I started taking post-op were vitamin C, zinc, magnesium. What is it called? Bromine, something. It's the enzyme that's in pineapple that is supposed to be good for healing. It's like anti-edema and all that good stuff, I believe. Took that. A few days post-op, I started getting horrible leg cramps, and that was terrible. Now, leg cramps are something that I'm prone to. Nocturnal leg cramps runs in my family. It's a very strange thing. I have managed to keep it at bay pretty well 99% of the time because I just know my body and I know how much I need to drink in a day. I know what the signs are when it's starting to come on. And that means probably I'm low in electrolytes. So I will start taking literally salt. I'll just eat some pinches of salt and potassium, magnesium, and up my water intake and all that good stuff. There's also a tonic water that has naturally occurring quinine in it, which used to be, side note, an off-label use for nocturnal leg cramps, but the FDA discontinued that years ago. But if you suffer from that, and just go get tonic water and make sure it's the one that says it contains quinine. It's great. But I started getting those for several days because I obviously was not drinking enough. And so that's terrifying because if you've ever had nocturnal leg cramps, you wake up from a dead sleep and you have to immediately jump out of bed and start stretching aggressively, or your leg, it feels like it's going to be curled up and frozen in that position forever. Well, there's no jumping out of bed post-op. That's like a 15-minute procedure. So there were a couple of very miserable nights dealing with that. That was hard. Yeah. And getting up in the middle of the night, searching for the tonic water and trying to walk, and it was bad. It was bad. But I have tried to stay on top of supplements every day. I've gone as soon as I was able to start driving again. I started getting my favorite green smoothies from Tropical Smoothie Cafe. I get a detox island green that has all the ginger and all the good stuff in it. I really, really believe in those. I mean, I get probiotics added to it. And probably my most asked question about my procedures is how much weight did I lose? Like, how much did they cut off, from the surgery? And I have to tell you, first of all, I have not weighed myself since surgery. And they tell you not to over and over and over again because they know that patients are going to have so much edema post-op. So I think they just really don't want anyone to get on the scale and be mortified that they haven't lost weight or whatever. So I truly have not weighed myself. My hands, my feet, the edema it's there. And so I probably won't weigh myself until I feel like that has started to go down. But I did ask my surgeon, how much did you take off? And he said, I believe, because this was in PACU, but I believe he said 4.1 liters, which is about close to 10 pounds or so. Now, he explained that 5 liters is kind of the limit that they try not to exceed because anything beyond that can cause the fluid volume shift and that can come with complications and all of that. So he was pretty close to that. But, once everything settles down and I weigh myself, I'll definitely be making a video about that at some point. So there was a lot removed, but I couldn't really tell you exactly how much weight I've lost. So I had my daughter stay with me for about 5 days, and then she had to return to work. And I had my mom here as well. And that was wonderful. I don't know how I could have done it on my own. I don't think I could have. I would have had to pay someone because it's truly impossible. You need someone there with you. And honestly, I needed someone more than the 4 or 5 days. But it is what it is. Like she had to go to work. I couldn't, but you really do need a dedicated person to take care of you after this. I cannot emphasize that enough. And it's hard if you don't have it because then the emotions kick in and my God, the pity party, and it's a lot. It's a lot to deal with. But I would tell people be very selective in who your caregiver is going to be post-op because your spouse, your significant other may not be the best caregiver person for you. You need someone that is truly going to be committed to just taking care of you and not whatever else they might do in the course of a day. Someone that is physically strong, that is going to be able to help you move, change positions, someone that is empathetic, that's going to listen to you, that's going to be, able to lose sleep to make sure you get what you need. Like, be very selective in who your caregiver is going to be post-op. That's very important. So I had my surgery on a Friday and my first post-op appointment was on Monday following. So post-op day 3, went in looking like just hell. I don't even know how I got in there that day. I could barely walk. They took out the Foley that day, which was great. So glad to have that gone. I was very paranoid that I wouldn't, because nurse, you see this happen all the time, right? That I would have urinary retention and not able to pee, and then I would have to go to the ER. I was very paranoid, but there was no issue with that. It was also the one thing I was most nervous about pre-op was having the Foley. I made a video about it. I didn't want one. I fought and fought and fought. I don't need this. I can get up. And he told me, the surgeon, you'll be glad that you did it. Trust me. And he was 100% correct. They put it in after your under anesthesia anyway. I was so glad that I had it because I cannot imagine having to get up those first few days every time you have to pee. It would have been hell. So he was absolutely right. So Foley came out day 3, no problems peeing. After that, still had the 2 JP drains. The first JP drain was taken out at my second post-op appointment, which was on the following Friday. So 1 week post-op. My surgeon wants for them to be under 30 mLs output per 24 hours before they get pulled. So the one on the right was, the one on the left was not. Here we are 3 weeks later, and it's still there. It'll dip down to 30, and then it'll go right back up to like 55. It's been very frustrating, but knock on wood, the last 2 days have been under 30. Keep your fingers crossed for me that I can get it out on Monday because I am really at the end of my wits. It's starting to pull. I can't deal with with the JP drain anymore. 3 weeks has pushed me to my edge with this JP drain. A lot of people asked if it was painful coming out. No, it wasn't. And I've taken them out myself as a nurse. It's really not a big deal. They're sutured in. You just clip the sutures and it comes right out. You need to make sure it's not compressed and plugged prior, or else that would be painful. And then it just slips right out. It was fine. Okay. So you're not supposed to drive for 2 weeks. I ended up driving like 2 days earlier than that because I just didn't really have a choice. And it was fine. I just was careful, somewhere around, I don't remember when, I think it would have been maybe day 9 post-op, maybe day 8, something like that. I realized my right arm incision had dehisced, which means that the incision basically has opened, which is not good. That's not supposed to happen, right? The portion of it, about 1.5 inches of it in my actual armpit area, which only makes it worse, had opened and was draining and was infected. And so this was not good news. And I am still very much dealing with that. And so I got a hold of the doctor's office. It was on a weekend. And they immediately did call in antibiotics for me. They put me on rifampin and Bactrim and took me off the cephalexin, that was really just prophylactic while I had the drains in. So started on the antibiotics, double antibiotics. And I am not a person that likes to take a lot of medications, and I very much worry about like my gut microbiome. If you're on too many, E. diff and all the things. And so I was really upping the probiotics and immediately ordered Juven. For those that don't know, Juven is a medical grade drink that we give patients for wound healing. It's specifically to help aid wound healing. That tastes like ass. I am here to tell you. To be fair, I've only tried the fruit punch flavor. When this one runs out, someone has recommended I think it's like a pina colada flavor or something. So I'll try that one next. Whatever. I'm drinking it every day, no matter what, because I'm going to do anything and everything to get this arm healed. I'm drinking protein shakes because it's very important that you have a high protein intake for wounds to heal. I immediately started going out in the sun every day. This is just me. The doctor did not tell me to do this, but I go out in the sun almost every day since I realized the arm incision was infected. And I put my arm up into the sun as much as I can. I can't really raise it all the way up. In fact, I have very limited range of motion, but I put it up into the sun, hold it there for a couple of minutes, put it down, rest, hold it back up, for like 15 minutes or so every day in the sun. And I believe in a little bit of sun therapy. So I'm doing that. I'm taking the Juven. I have had a fight with the compression garments. Nothing prepares you for these compression garments. First of all, I didn't realize that you have to wear them for so long. I've had people telling me, if you really want good results, you need to wear those for like 6 months or more. 6 months? What are you talking about? 6 months in these things? Oh my God. So constipation kicked in. This has to do with the compression garments. Okay. Kicked in like, I don't know when, day 4, maybe 5, something like that. maybe day 5, I realized I had not had a bowel movement yet since surgery, which is not completely abnormal. You usually won't go for a couple of days after surgery. Plus, you're not eating as much or drinking as much. But once it started to be like day 5-ish or something, and then right about the same time I'm realizing the number of days is when I realized, oh shit, I think my stomach is distended. I went into nurse panic mode and I'm like, oh no, we're not doing this. We're not doing. I stopped the pain meds cold turkey, like never took another one again, not once, because the pain medications will constipate you. So immediately stopped those, still took the muscle relaxers for several more days. I've been off them now for quite a while, but several more days, only because the fear of coughing is the scariest thing in the world post-op, because that feels like, someone is cutting into you with a saw if you have to cough, right? So I kept taking the muscle relaxers anytime I thought I had a tickle in my throat or anything, just to keep the urge to cough at bay. But going back, so I switched over to Tylenol mostly, occasionally Motrin, but mostly just Tylenol. So got off the pain meds, started doing like Benefiber, Miralax, Colace, and I had a couple of very miserable days, very miserable with constipation post-op, to the point where my stomach was getting so distended that I couldn't wear the garment anymore. Like it's, obviously it's very tight, the compression garment. There's a million hook and eye closures all the way down the entire thing. I literally could not close it. And I was concerned. I'm like, I'm going to end up in the ER if this doesn't. What is going? It was bad. Finally went. I know this is way too much TMI, but if you're listening, you're probably a nurse and it doesn't bother you. So finally things kicked in and I was able to successfully go to the bathroom. And that lasted like the better part of a day of going, because I had taken so much that then everyone's been there at one point or another, right? And you have the horrible stomach cramps. And so I went quite a bit, but I don't think I even went enough. I wasn't emptied out, if you know what I mean. And so it just kind of began this roller coaster that went on for maybe a week or so of, okay, today I feel pretty good because I had a bowel movement. I'm able to wear the compression, followed by the next day when I wouldn't have a bowel movement and my stomach would immediately get distended again and couldn't quite use the compression, or it would be so uncomfortable. And it just was like this roller coaster. And that, like I said, was about a week of just ongoing until it finally now, knock on wood, seems to have stabilized. I seem to have a pretty good routine going on. There is something really, I don't even know how to describe it with the abdomen. I don't know if this is just me. Let me know if you've had this surgery, if you had something like this. But your abdomen gets rock hard, and it's in these waves. Now, I don't know if this is like a peristalsis thing or if it's a surgical thing. I don't know, but I've never experienced anything like it. And rock hard, okay? And almost distorted or misshapen and almost was like contractions, for lack of a better term, like the waves of contractions when you're in labor or really bad menstrual cycle cramps. It's so hard to explain and it's so unpleasant and it's concerning because you're like, this isn't normal. What is going on? So I would say to anyone, stay on top of being proactive about avoiding any constipation. Like immediately following surgery, don't do what I did, which is where I'm not going to worry about it for a few days because it's normal not to go right after surgery. It is, but don't ignore it. Be proactive about it, That would be my advice, because that was truly hell. And so then at maybe like my third post-op appointment, maybe, I said, look, okay, this is going to be way too much TMI, you guys. Sorry, not sorry. I'm like, why do I have a FUPA? Y'all, I never had a FUPA before surgery. What is going on? It was all down there at the bottom and it looked deformed. Okay. So he thought maybe that I had a seroma, which is fluid filled. Okay. So he took a big old 60 ml, 18 gauge into my abdomen, a couple different areas to try to aspirate fluid, but only got like 1 or 2 cc's. So not a seroma, which is good. So then we realized it's probably edema. Now, the compression garments that they sent me home in and that I had bought another one of was It's like a full bodysuit. So it's the sleeves, the whole abdomen, and the upper legs above the knees. One piece, okay? But it's open at the bottom to allow you to go to the bathroom. And then you have to kind of keep it a little open at the bottom for my JP drain to come out. And so what we think is that that garment basically it pushed everything down to the area of least resistance, which would have been the fupa area. If you don't know what that is, look it up. It's like your mons pubis area, okay? And so that's where I had this abnormal collection of edema and it made it look deformed basically. So that was very disconcerting. And so we switched my compression garment to a different style that has closures like right underneath, like you would with your underwear. It doesn't go down to the legs. There's no opening at the bottom. So it would not allow for any edema collection there, if that makes sense. And that does seem to have helped significantly. It still is a little wonky, but it's much better than it was. He did tell me just a couple days ago at my last appointment, I need to start massaging that area, which is so uncomfortable for me. It's not that it necessarily hurts. It feels wrong to do, if that makes sense. Like I shouldn't be applying pressure to this very sensitive area that just had surgery. And I have to kind of force myself to do it. It feels very unnatural and like I shouldn't be doing it. And so a lot of people are telling me that I have to get lymphatic drainage massage, which I've had once before prior to surgery. I didn't feel like it really did anything, but I've only gone the one time, so I don't know. But I have been inundated with people saying, no, this is so important. You have to do this right away. As soon as your surgeon clears you, you have to get in for lymphatic drainage. Well, first of all, I cannot imagine anyone touching me right now. I still have a drain. I have an open wound. I have incisions that are not healed. The thought of anyone coming near any of those areas is terrifying. I cannot imagine. However, I recognize the benefits potentially for the lymphatic drainage because the edema post-op is real, you guys. It is real. I still can't put my rings on. My feet are getting a little swollen. I've heard that this can take up to a year, which is so depressing. And so I recognize, something needs to be done to expedite this, right? It's just scary. I can't imagine doing that right now. Well, my surgeon has not cleared me for it anyway. He said, I'll let you know when you can, but you're not there yet. Okay. So I will. My plan is to start lymphatic drainage when he's cleared me, but I am going to be so nervous about doing that. And I'm going to have to really find someone good that I can trust because if you touch me in the wrong spot, I'm going to lose my mind. Like I can't imagine any kind of pressure in those areas, like massage pressure, And I don't know, maybe it's not like that, but the one time I had the lymphatic drainage, I can't imagine having that and how the way everything is. So at this point, at 3 weeks plus 1 day, I think that I should be able to get my last drain out this coming week. Knock on wood. I said that a week ago though, so I'm trying not to jinx myself. He thinks that my arm will take 4 to 6 weeks to heal, which was so hard to hear. Like that to me right now sounds like an absolute eternity. An eternity. And I'm already a very impatient person to begin with. But this is what I mean when I say I was not prepared for this recovery. I really thought you hear, okay, people go back to work 2 or 3 weeks. First of all, I cannot imagine it. 2 weeks, there's no way I could have gone back to work. Maybe next week, maybe. I cannot, especially if you have any kind of a physical job. Absolutely not. And I heard from a nurse actually that said that she went back as a bedside nurse after only a couple weeks, and she has a really significant scar on her arm incision from the brachioplasty because of all the reaching up to the IV poles and stretching where you shouldn't be during that post-op period. So, I mean, you really do have to be careful. At my last appointment, he debrided my dehisced surgical site wound area. And I'm a big baby. Like I love wound care when I'm on the other side of it. But when it's happening to me, I can't look, I can't watch. Every time I feel something, I feel the need to say, I feel that. Such a baby. It really didn't hurt that much. But since then, it has hurt significantly to the point where I'm like, I don't ever want this debrided again. because it's so sore now. I will say, though, that it does look like there's more granulation tissue now. So that's good because that's what you want. They did give me an ointment to put on twice a day now. I forget the name of it. I'm doing that. But it is so miserable because it's literally in my armpit, like where you bend. It's right there. And oh, here's the other thing. You can't wear deodorant because you have incisions there. I haven't been able to wear deodorant in over 3 weeks and there's no end in sight. So for that reason alone, I would say don't do this in the summer. A lot of people were criticizing me, like, why are you doing this over winter? You're going to be wearing baggy clothes for months afterwards. No one's going to be able to tell. Well, now I'm glad I did now because God forbid it was, I'm in the desert. It's hot as hell. If it was July and I can't, oh my God. But it's miserable because I'm constantly feel sticky and gross no matter what. I can't, you can't put anything there. It's a healing incision. Even on my good arm, I wouldn't put deodorant yet because it's still not healed. And so God knows when I'll be able to do that again. It's terrible. And so it's draining. It's in my armpit. I have to constantly keep 4x4s or an ABD pad there. It's not draining a great deal, but enough. Like I have to change it a few times a day. Anything that rubs on it, it hurts. It hurts. It's so sore. It's in the worst possible place. I think if it was lower down on my arm, it wouldn't be nearly as bothersome. But because it's right there in the bend, it's terrible. And I know there's way worse complications that can happen. At this point, it's like 1.5 inches long. It has gotten a little wider. That is concerning. I am concerned. I am concerned about this arm wound. I really am. My doctor does not seem concerned. He's like, this happens. It's a whole thing with tension with these surgeries. And it's like this invisible line. You never know. You go too far, you risk this happening. You don't go far enough. You don't get optimal results. I get that. But I was not prepared for this happening and for it to take weeks potentially to heal. And I know how slow wounds are to heal. And it's in such a bad place to heal. That is just really messing with me. I have very limited range of motion. And of course, it's my dominant hand, which only makes it worse. This weird, you feel like I can reach that slight distance away, but it never fails. It's always right past this point of this invisible line of, no, you just reached a little bit too far. And now it's burning and it hurts. And I'm trying really hard to remind myself to only use my left hand when possible, but that is not easy. So that's where I'm at. It's the battle of the compression garments, trying to wear those around the clock, which is rough. It's rough. Worrying about my arm. Can't wait for this other drain to come out. Oh, I can't stand up straight still. I feel like I'll be doing okay. I'll go out. I'll do a couple errands. Haven't really gone out much at all. But then when I'm walking in public, I realize I am so hunched over like a little old lady. This is embarrassing. And it's normal after the surgery. They tell you you're going to be hunched over for a while. But how long does that last? When am I going to be able to stand up straight again? And I will consciously stand there and try to will myself to stand up straight. And I can get a little straighter, but I'm certainly not straight. So that's embarrassing. That makes me not want to go anywhere,
Now for your enema of the week.
Have you ever noticed that nobody ever wants to talk about gut issues until they're having gut discomfort? And then suddenly everyone's Googling it at 2 a.m. Is this normal to feel this way? Spoiler, it is normal. And you shouldn't have to suffer in silence. That's where our podcast sponsor comes in, Happy Bum Co. The user-friendly solution for at-home gut relief is actually designed with dignity, ease, and your comfort in mind. Look, we normalize labor, trauma, and bodily fluids. We can normalize gut relief too. And the Nurses Uncorked community sends me messages about it every single week. One listener wrote, Erica, I was scared to try it. I didn't want to admit that I needed it. Then I finally used it, and I swear I heard angels singing 10 out of 10 recommend, Melissa RT. And then this one really got me. She said, 3 kids, night shift, questionable hydration, and 0 time. Happy Bumco saved more than just my gut. It saved my dignity. Danielle, LNDRN. But this one made me laugh. I wasn't blocked. I was barricaded. And Happy Bumco broke down the doors like the Kool-Aid man. I mean, if those reviews don't say it all, I don't know what does. Happy Bumco is the real deal. Whether you're dealing with travel, stress, dehydration, shift work chaos, post-holiday bloat, which is coming up very soon, or honestly, just being a human being with a digestive system that didn't get the memo, you deserve a solution that works. So do yourself a favor, or do your family member in need a subtle favor, and visit happybumco.com. That's happybumco.com and use code NURSESUNCORKED to get 15% off your first bundle. The link is in the episode description. Ladies and gentlemen, our Enema of the Week award goes to Justin Riney, a nurse who's made it his years-long one-sided crusade to defame me from the safety of his beloved scab nurse corners. For years, he's made it his mission to pop up in every comment section, every thread, even though I've blocked him, and every scab nurse group to incite hate against me, and then he just files it under his hobbies and pastime. For context, Justin was one of the organizers of the failed National Nurses March years ago. Let me be blunt. The planning of that fiasco was one of the most chaotic, mismanaged things that I've ever experienced in my life, and I work in healthcare, okay? That says a lot. Volunteers left in droves on a daily basis because of the incompetence, confusion, and lack of communication. And I left for the very same reasons. Buddy couldn't organize a march, but somehow he found time to organize my fan club. If you're not familiar with the story behind the planning of the failed National Nurses March, Nurses Uncorked episodes 27 and 28 break that down in detail. And it's not just my opinion. There's 3 of us on those 2 episodes that were all involved in separate, different ways, sharing our experience, and it was unanimous. So give episodes 27 and 28 a listen if you're not familiar. Now, I have never known Justin Riney. I have never met him. My involvement with him consisted of some short-lived sporadic Facebook Messenger group chatter and maybe one group phone call. Each interaction resulted in a new what the fuck moment of confusion due to the complete and utter lack of leadership. He has never known me in real life or even had any meaningful interaction with me whatsoever. And yet, for reasons known only to his keyboard and questionable taste in online hangouts, Justin has spent years popping up in scab nurse groups and comment threads, painting himself as the one sage witness to my alleged sins. In my experience, that's less insider and more obsessed bystander. I occupy way more space in his head than he's ever spent actually talking to me. What is it they say? You know you're that bitch when they can't stop talking about you? Well, Justin, congratulations. You've passed that test with flying colors. He is clearly a fan who can't stop fangirling over a version of me he invented while desperately clawing for attention. Justin Hunt, at this point, you're not a critic, you're a subscriber, and your ongoing commentary is proof of that. He recently reared his head again with the historic Kaiser strike last month. There he was again, as usual, predictable, in all of the comment sections, berating me, and in all of the scab nurse groups, berating me. And that's when I finally said, enough. I'm done staying quiet about this year after year. This is actually illegal activity. I'm not standing for this defamation any longer. Justin, darling, I'm done. I have receipts of your libel activity going back years, and I am not afraid to use them. You don't want justice, you want an audience. And unfortunately for you, this is an American Idol, and obsession isn't a talent. His narrative is always the same in all the comment sections. He claims that he got to know me so well during the planning of the Nurses March and that he got to see my true colors, only him, and that I only care about myself and I am personally to blame, just me, for sabotaging the failed march. Yeah. That march was sabotaged and failed long before I ever got involved and long after I left. My true colors. My true colors. Do you mean me offering to help? Or do you mean Veronica Marshall, the founder of the march, asking me to help? Or putting me into planning groups that never actually planned a damn thing? Or do you mean me offering to speak at the march or promote the march or give you all the free advertising you could possibly need? Those true colors, Justin? Yeah. But I discovered something that I was not expecting. I'm honestly still a little bit in shock. when I was preparing for this Enema award yesterday. There's another reason that Justin doesn't like me that I was completely unaware of. And it's because I refuse to give him the attention that he is clearly so thirsty for. You see, back when I was at the Kapiolani nursing strike in Hawaii, there was a travel nurse that was terminated during the strike for going down on his break to the strike line to support his colleagues. Yeah. And so several nurses approached me and said, "Hey, did you hear about this? This is something you should probably talk about. Maybe you can highlight this story. He's a nice guy, travel nurse we've worked with for a while." Well, I immediately recognized that for what it is. He's a scab. They didn't realize it, but once I explained it to all of them, it was like a light bulb went off. You see, because travel nurses, even if they're there on contract before a strike, they have to inform them that there's a strike that's going to occur ahead of time, right? They have every right to break their contract. And responsible travel nurses do. They don't stay and cross the line, because crossing the line, regardless of any superfluous details, by definition makes you a scab nurse. I mean, responsible travel nurses, they already have the no strike clause in their contracts. But if they're stuck out there with an unexpected strike, they break their contract or they call in sick, because they would rather do that than be caught dead crossing a strike line. But not all Justin, who lives, breathes in every scab nurse group online. That's clearly his bread and butter, it would appear. Allegedly. Allegedly. So when they told me this had happened and I said, "No, that person's a scab, let me explain this to you," they all had a revelation moment and went, "You're right. Never thought about that. You're absolutely right. He is a scab. There's a ton of travelers out here on the line with us that chose not to keep working and crossing the line." So I refuse to give him the attention that he so desperately craves. And I think that I've been pissing him off for years, unbeknownst to me. I had no idea that was him. Allegedly. And that's why this award is for Justin Riney, who confuses stalking with meaningful contribution, and for turning petty gossip into his full-time sport. That's why you get the Enema Award, because you're persistent, like a rash that you can't get rid of. So take your trophy and try a new pastime. Maybe something like, oh, I don't know, organizing something that doesn't implode and set the entire nursing profession back decades. See, some of us are going to leave behind a legacy, and some of us, like Justin, are just going to leave behind comments. And now back to our regularly scheduled programming. Everything feels just like super tight and weird. And while I'm independent in moving and transitioning and happen for a while now, it's also it's with intentional movements, and it's avoiding any sort of twisting motion, because occasionally when I, especially in bed, will inadvertently like twist or move in a weird way, oh my God, it's painful. It's painful. So that's still a thing, very much still a thing. The weird tightness all around, and oh, this numbness. What is that about? I don't even know how to explain it. My back is still numb, but yet you will feel it itch, and then you go to scratch and you can't feel yourself scratching it. It's the most bizarre thing. How the hell long does this last? Does anybody know? I've asked. I've not gotten a straight answer. How long does this bizarre phantom numbness last? Because it's been 3 weeks. It's very strange. I will say I did have a moment at my last checkup, my last doctor's appointment, where I was on the table and there's a mirror directly across, which is mortifying. And I'm basically uncovered, like basically naked. He's getting ready to do his thing. And I caught a glimpse of myself in the mirror. And it's the first time I have seen myself post-op, like in that position where I'm sort of seated, elevated. I've only ever looked at myself in the mirror since surgery, standing straight up, you know? And so I was in this position, seeing myself for the first time, and I thought, okay, but that stomach is flat. Okay, I have a waist. Okay, I see you. I was not expecting that, and that was great. Like, for a split second, I was like, okay, I see a light at the end of the rainbow right now. Okay, have not seen it this whole time. Now I see what I'm looking forward to. So that was nice. That was a little boost in confidence. But then you go to put on clothes, and I have to wear these terrible baggy clothes because I still have a drain. You know, I can't move my arm. I can't do anything that is hard to put on, you know, so I'm not able to wear anything cute. And then I do still have a little bit of edema in like that area. And so, Yeah. Am I reaping the benefits of it yet? No. And people ask me every day, "Are you glad you did it?" I'm glad that I finally mustered the courage to do it. I am not there at the point yet where I can say, "Oh yeah, so worth it. So glad I did it." I'm not there because life day to day right now is a struggle still. And people say, "Well, doesn't it get better every day?" Yes and no. It's like you trade your problems. So one thing starts to get better, but then there's another thing that you're dealing with, especially with me with my arm. Now, if it weren't for the arm, I think I'd be in a much better headspace and feel better about it than I do right now. A lot of people are saying when you get to about 2 months, that's when you really are like, okay, all right, this is good. I'm so glad I did this. Well, I'm at week 3, and so 2 months seems like an eternity to me, and I just hope and pray that my arm is healed by then. Yeah. So, like I said, this is something I've needed to have done for many, 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 many years after 2 kids and gaining weight, losing weight prior, and then gaining some of it back during COVID. And then I've been on the GLP-1s and lost quite a bit of weight, still have some more to lose. This has been a long time coming, and I'm glad that I finally did it. I'm glad that I finally was able to do it. I'm going to be paying for it for quite a while. So when I say able to do it, I mean, I got it done, but I'm going to be paying for it for a minute. I'm sure I will eventually get to the point where I'm like, God, I wish I had just done this 15 years ago. At this point, it is inhibiting my life so much that it's hard for me to be in that mindset, if that makes sense. I don't want to sound ungrateful or like Debbie Downer, but right now it's still rough. When it takes me 35 minutes every morning from when I get out of bed to before I can leave my room. And that's not showering. That's just going to the bathroom, emptying the drain, putting on all the compression garments correctly, changing out gauze, trying to get my hair up, and I can't quite lift my arm up. So that's, like 35 minutes just to do these basic little things. It's very frustrating because everything takes forever. And so I have felt very unaccomplished the last few weeks because I'm hard on myself when I don't get things done and things pile up. It's a lot of stress for me. And I didn't think I would be doing that post-op. I thought, yeah, there's going to be a few days where I'm out of commission. No, I've been basically out of commission for 3 weeks now, and it's not getting a whole lot better. I mean, this is the first podcast thing I've kind of sat down to do. I've been posting intermittently. I've gone several days in between, which is not like me. I did make a point of posting about the Kaiser strike when that was going on because I really wanted to support them. But I have a list a mile long of stories I want to cover, and I just have not had the motivation or strength to do it. And also the sleeping is insane. I normally sleep like 7 hours a night, maybe 6.5. I'm usually up like 5:30. I don't know what the hell is going. I'm literally sleeping like 11 hours a night. It's starting to taper off a little bit now, and then I sit there every day at the end of the day going, why did I get absolutely nothing accomplished? I'm sleeping half the damn day. And then everything that I do takes me 3 times as long. That's why, you know? So I put a lot of pressure on myself to get things done, but I did want to let all the loyal podcast listeners know that thank you for being patient. Yeah, let me know what other questions you have. Let me know if you would like me to do another follow-up on my post-op recovery down the line at like month 2, 3, whatever. I don't know. Let me know. I hope I've answered everyone's question. Maybe I could get Dr. Roth to come on the podcast with me. He has his own podcast, actually. I will link it I don't remember the name off the top of my head, but I will link it in the episode description if you want to check his out. Have not talked to him about this, but maybe if I do another episode on this in a couple of months, maybe he will come on and be a guest and talk about the medical side of it more so and explain some of the things that I can't explain because, like I said, it's been rough. I feel like my judgment has been a little bit clouded through recovery and expectations and from being a nurse, unrealistic expectations maybe. But that's it for now, you guys. I want to thank everyone for staying tuned in and for downloading this episode of Nurses Uncorked. Please share it with friends, family, colleagues, and consider becoming a patron of the podcast so you get early access to episodes and a whole lot more. There is a link in the show notes. Until next time, I'm Nurse Erica. Be fearless and don't let the bastards grind you down.